Give that a go now.
Hang on. Settle down, Mick. Hang on. Hang on, sorry. All right, we got that?
Once you go for these,
Sick.
Got it.
All right, you're recording? Do you want me to hit record? You're recording?
No, I got it at this end, mate. Thank you.
Got it?
Yeah.
Sick. All right. Cool. All right, we're talking about plyometrics. So this is, Stacky's had this in the works for us for a while, so we're going to talk plyos. Basically, it's something that should form the basis of rehab. Not the basis, it should be part of your rehab for pretty much any injury. It applies to people getting back to sport and people who are uninjured looking to improve at their sport. So it's a part of rehab, and it kind of sits kind of alongside strength work as well. So when we talk plyo, and this is kind of, I had to go through all this, and it's good to just sit back and look at what it actually is. So it's a stretch shortening of a muscular tendinous unit. So every time you jump, you run, you throw, you catch, that's all plyometric to an extent. So when we go through the three phases, there's a rapid eccentric lengthening, there's an amortization phase. So that's basically when you're working, the muscles are working isometrically. So say we're talking like hopping. So at the bottom of a hop, when your foot's in contact with the ground, your calf is working isometrically and your Achilles tendon is loading up. And then there's the concentric phase where you explode up off the ground. So they're the kind of the three phases of like what we call a stretch shortening cycle. So that's how it kind of works. And now a lot of the time we want to try and diminish the length of time of the amortization phase, which makes you faster, makes you jump higher, makes you more explosive. Okay. So in terms of rehab, this is something that I've been incorporating a bit more since looking into this last couple of months, is when we're rehabbing someone, where do plyos sit? So if we just go through it, initially you get an injury, you want to settle it down. Like, so we go via the old like settle shit down, get shit strong kind of framework, I suppose. So settle things down, and then you want to start to build a baseline, right? Which is just getting things moving again. And then we want to increase tissue capacity. That's where we do all our strength training. And I think everyone in this team is pretty good at that sort of stuff. We know we need to get things strong, but then beyond that is like conditioning them more for the sport they're trying to get back to. So yes, get things strong, but then add in some plyos as well. And then part of what makes iMove is what we've done for years and years and years, is get people back to where they were, not just to where they were before they get injured, because that's the state that got them injured, but get them better to that, get them better than their pre-injury state. And plyos form a part of that as well. So whilst you're getting towards the end of rehab, you're doing hypertrophy strength training, you're doing plyometrics, and you're doing sport-specific stuff as well. So that's what all rehab should start to look like when you get towards the back end of it. So we're not doing plyos week one often. Okay. And also for the uninjured athlete, there's like decent literature out there that just doing plyometric training can increase performance gains. So pretty convincing stuff on jump height, sprint performance, muscle strength. It improves your change of direction and improves your throwing and hitting. So even with like Roy's stuff, tennis, I'm sure Roy does a lot of plyometric stuff in the upper limb for that. Anything change of direction for touch footy, anything running and jumping. So it's relevant for the uninjured athlete and also for the athlete going through rehab. So when we go, okay, so this is when we're starting to put it into rehab. There are different, when we break down plyometrics, there are different parts that we want to do. So the way you should start, or like the least aggressive form, is just the eccentric absorption. So eccentrically in a plyo, that would be like, say, altitude landing. So jumping off a box and just landing. So not springing back up, but putting that as the first phase of your training. So jumping down and just landing eccentrically. And then separate to that, the next thing you want to add in with your training is the concentric portion of it. So that would be like a box jump, where you're just starting from the ground and pushing up. So that's kind of the next level of demand, I suppose. So first eccentric, second concentric. And then once you're training those independently and the athlete is tolerating them, then we want to combine it all together into a stretch shortened cycle. So that would be where you're doing a squat jump. You combine the eccentric and the concentric to a squat jump. That's when you're doing any of those movements there. If they're handling a stretch shortened cycle, then the next thing is to expose them to repeated stretch shortening cycles. So that's when you're doing multiple squat jumps, multiple box jumps, multiple hopping, jumping, whatever it might be. And from there, then we want to add in shock, which is the last thing to do. So if we've had someone doing squat jumps and that's their plyometric activity, then the shock element would be jump off something that's 1 meter tall and land and absorb that and have like rapid force going into them. So they're the kind of the stages that you want to go through. So when you break it down like that, you should be able to apply that to any injury and any kind of body part. You all good so far? Yeah. All I can see, Stacky, on my screen is just your face. I can't even see my own face, just you staring at me. Makes me nervous. Makes me nervous. Let's go through this with the patella tendon. It's a pretty straightforward way to do plyos if we just think about how do we plyometrically load a patella tendon. So the first one, your absorption, would be an altitude landing. So just stepping off a box and landing and sticking it. So that's your eccentric absorption. Concentric, box jump. So jumping back up onto the box. And then stretch shortening cycles, a squat jump, super easy. Repeated stretch shortening cycle is repeated squat jumps. And then the shock is landing off a big box and landing aggressively hard and tolerating that. So that's like a patella tendon example. Okay. Now,
I was just going to say with the eccentric absorption, like if altitude landing was too high level for them, like you could just do tall to shorts as well.
Yeah.
So like take away that gravity element of it, and so they just get into that position, and then it could be single leg tall shorts, like things like that if they are provocative.
Yeah. Yeah. So
is everyone familiar with a tall to short and altitude landings?
Yep.
Is anyone unfamiliar with it? Just raise your hand if you're not.
If you're not.
Mangles,
Tall to short.
Joshy.
Do you want to do a tall to short, Belly? Belly's going to do a tall to short.
Demonstrated.
And finishing down into this position. So starting tall and trying to absorb that eccentric force, as quickly as you can and with intent, and then going to, a single leg. So you try and, obviously you're not adding the element of gravity like with an altitude drop.
Yeah. So you're not jumping from a height, just going from straight leg into bent leg rapidly. Okay. All right, let's play. So wait, before we get to that. So there's a couple of things you want to consider when you're doing these or prescribing them is, do you want it to be intense and do you want it to be complex? So these are the things that, again, like there's no right or wrong. It's going to be different for every individual, but you've got to be able to justify and have reason for, are you making this intense or not intense on purpose? So like two-legged little jumps, pogo jumps, is really not that intense, but compared to like jump lunges is very intense. So what's your reasoning for that? What sport are you getting them back to? And then complexity as well. You don't have to be necessarily that complex for an Achilles tendon, but if we're getting back to rehab, getting back to sport after an ACL, you've got to be pretty damn complex. So end stage ACL is going to be intense and complex if they're going to get back to sport. Whereas getting back to running after an Achilles issue could be intense, but not that complex. So different ways to think about programming these as well. And you've got to ask those questions. How does this best prepare the tissue for load to get back to the sport? And how does this exercise prepare the athlete to get back to their sport? So that should kind of guide you into whether you make things intense or complex. That's kind of how we think about them. All right, cool. I want everyone to go through this for the Achilles tendon. Why don't we put it in the chat? Write it in your chat box, but don't hit enter.
Ooh.
Yeah, do that. I'll give everyone 2 minutes. 2 minutes. You're going to go through these, whoever you're sitting next to or by yourself. Put it in the chat box, 1, 2, 3, 4, 5 for an Achilles tendon, 2 minutes. And then we'll get everyone to hit enter at the same time. Sick.
What do we do? Enter into what? Slack? CPD?
No, just the chat box here.
Oh.
Or should we do it on Slack? No, we'll do it here. Okay. So how do you do the eccentric portion for an Achilles tendon? How do you do the concentric?
Too quick, Mitchie.
Yeah. Give you 2 minutes. All right. Can you give me that like thumb react when you're good?
You got testing out the Zoom. I love it.
Risky's done. Anyone else done? Yes, no. Okay, give you a minute. What would you do? You got any, Ronnie? Don't say that. They're listening.
What are we supposed to say to?
I don't know. Have you got them?
Yeah.
Okay.
Yeah.
All right. 20 seconds.
Just asking questions.
20 seconds. Anyone not ready? Fuck, it's quiet. It's really quiet when you're the only one talking.
I'd say that, mate.
All right, 5 seconds. 5, 4, 3, 2, 1. Hit enter. Go. Oh, fuck yeah, like this. All right. Who got in? Josh O. You go through Josh O's. Okay, so what do we got? So if we're looking at how to load an Achilles, we've got drop land. Good. That's eccentrically absorbing through the Achilles. Fast calf raise. Good. Jumping. Yeah. Pogo jumping, repeated. Drop dump from height. Cool, Joshua. That's sick. That's awesome. Daniel. Who's Daniel? DK. Wall drill. Hey, DK, what's wall drill? What's that?
That'll be me, mate.
Other Daniel.
I was looking forward to Kalapski's. What's a wall drill?
For some reason, I've got 2 Zoom accounts through Google and Facebook, so I don't know which one it logs into.
Can you go through wall drill mod?
Yeah. So, are you familiar with a wall drill in the first place?
No.
So it's basic. Oh, hang on, I got headphones in. What's that?
You can do many drills on a wall.
Basically. Let me we're going for a walk. So it's essentially where you're in this kind of a position.
Yeah.
Coming up there, and then that eccentric phase is coming down and being able to absorb that at the bottom. And then if you want to turn it into something like a more of a rapid, short stretching. So more creating that horizontal force.
Yeah. So is that your number 3? Is that your wall drill calf raise?
Yeah, and then pogos would just be on the spot.
Yeah. Yeah. Cool. Nice. So risky edge of step drop, easy drop and recovery phase. Hey, Mick, what do you reckon? What do you mean by drop and recovery phase? Talk us through that.
I'm just trying to find you again. I would, the number 1 would just be dropping down without pushing back up. Number 2 would be dropping down and pushing back up into a calf raise.
Yeah, so that's like the entire stretch shortening cycle.
Yeah, would that not be appropriate for number 2, you reckon?
Yeah, because you want to do it without the eccentric in it.
Okay, I'm with you.
I think eccentric and concentric is the stretch shortening cycle.
Yeah, that's a number 3, isn't it? Yeah.
Yeah. Cool. Mengel's fast calf raise, quick drop calf raise, pogo hop, step jump. Yeah. Heiser, tall shorts, seated or paused jumps on a step. Yeah, cool. What's a CM jump? Counter movement. Cool. Repeated jumps, pogos. Lovely. Sick. All right. Pretty easy, right? So that's Achilles tendon, which is like a straight up and down, nothing too complex there. Do the exact same thing with the shoulder. So you have to think a bit harder for this. So can everyone like type it again in the chat box as you were before? Let's go through this with the shoulder. I'll give you 2 minutes. Hang on. And for this, I'm happy to do it if you want to pick like a volleyballer or a baseballer or a CrossFitter or like swimmer, whoever. I don't care if you want to pick something specific or just go through a drill. I don't mind. Shoulder in general is fine. Okay, 10 seconds, and then we'll post them. 10, 9, 8, 7, 6, 5, 3, 2, 1, post. Sick.
That was fun watching you guys on mute.
We weren't even talking either.
All right. What do we got? Josho, you were first. Josho, can you talk us through yours?
Yeah, so first one is we're kind of in a push-up position and then you're just dropping and catching yourself at the bottom.
Yeah.
Second one is you're just lying prone and you're just doing a fast push-up, just that phase of it. Number 3, we're doing like the full push-up. I guess maybe we could have changed that instead of like the whole clap.
Yeah.
Anyway, I like the clap, so let's keep it there. Clapping push-up, and then 4 is repeated clapping push-ups, and then 5 we're adding load by going on to like a decline. So it's a bit more force going through.
Sick. Cool. Thank you. Mick, can you take us through yours?
Yeah, I imagine my patient like on their back on the floor in the internal external rotation position. So
Yep.
I would have passing the weight over with your good hand and dropping towards the floor as number 1. I was thinking like a rotator cuff repair for some reason rather than like a pitch up, but it would work.
Yep.
Number 2, what did I have? I'm just going back. Oh,
Right.
so opposite, you'd pass the weight over and just go up for the concentric phase. Stretch shortening, you would do a bit of a waiver like that. And not for number 4, I had perturbation. So I would do it like that with someone pushing up and down.
Mhm.
And shock, then I went to standing up against the trampoline, like throwing the ball against the tramp and you have to catch it.
I think with those, that's eccentric and concentric, like slow strength stuff, whereas we're wanting more like plyo, like rapid kind of stuff as well. So you could do the rotation. You just have to emphasize, like, do it quick. So it's not just like a rotator cuff strength drill. I guess
Yeah.
Can you ask Mick to let Seb in?
Mick, can you let Seb in?
I can't see him.
Okay, don't worry.
Yeah, he's not here.
Yeah, I am.
Hey, Seb, you take us through yours then. Take us through yours, Seb. I want to hear what you do.
Yeah, sorry. Side note, I'm trying to get on with my laptop, so I'm not on my small phone. That's why I'm in the waiting room on my laptop. What did I put? I
can't see you here, Sebi, in participants.
Oh.
Yeah, try again. Try rejoin.
That's
I'll add
okay.
you when you pop up.
My apologies.
Oh, yeah, I got you. You're in, Seb.
Oh, perfect. I'm going to switch to my laptop.
Can you take us through?
Yeah. So my eccentric absorption was a tall to short from a push-up position.
Seb, can you mute one of them?
Is that better?
Yep.
Cool. And concentric expression was a push-up to a box, or if you think about it in a push-up position and you have like two 20-kilo bumper plates just to the side. So it's like a box jump with your hands. And then for jump integration or stretch shortening cycle, either continuous clap push-ups, low amplitude, so it's not super hard, and then continuous jumps or continuous stretch shortening cycle, doing continuous versions of that, low amplitude, and then a shock method like half kneeling shoulder tantrums with a really heavy power band.
Yep. Sick. That's awesome. That's really cool. Thank you. Heiser, can you take us through yours?
Push-up landings were the same as Josh, push-up position, and then just catching yourself so you don't face plant the ground. 2 push-up from the floor, so doing the opposite. So I usually get someone to hold like an inch off the ground, like an isometric, and then they have to push up as fast as they can. And then they just don't worry about the negative. They just set themselves up down on the ground. Clapping push-up, to progress that, usually just start doing like a full push-up of that as they push up tall, trying to get their hands off the ground. And it's just like a quick hand movement, and then eventually get them to be able to do claps or double claps, or even clap behind their back if they're really good. 4 to push up is actually getting them in a kneeling position, and they've got to catch themselves, like fall onto their hands and then do a push up and try and push themselves up. So kind of like as if you're doing a Nordic without the actual hamstring contraction. And the last one is the banded slaps, which is just a tantrum, setting a band up and like slapping it as hard as you can with a heavy band.
Yeah. And how do you prescribe that, Mitchie? Do you say do it for 20 seconds? Like, how do you prescribe that?
So with the tantrums, I would say like time-based.
Yeah.
Usually like 10 to 20 seconds is probably the most amount that I'd want, because after that they just get fatigued, and then it just starts to get slow and sloppy. So with as the plyometrics get harder, the dosage will reduce, and the time frame and the reps that they do would generally, I get them to do less. I get them to do like 3 or 4 sets, 10 to 20 second bursts with a decent rest between sets.
Cool. Sick. Awesome.
Yeah.
Can I just make 2 notes there, Paddy?
Sure.
Of
course
hang
you
on, I
can.
can't hear you clearly.
Yeah.
There we go. Just on point number 3, the stretch shortening cycle. The stretch needs to precede the shortening for it to be effective. So if you're doing something like a push up to a catch, you're actually going through a shortening phase, then you get that air time without contact, then you come down into the eccentric stretch phase second to that, but it's not followed by another shortening cycle. Does that make sense? So if you're doing a push up into the air, come down and catch, you're actually doing a shortening stretch cycle, which is not truly going to be a plyometric.
So
What if you did it the opposite way?
You would need to go from the top,
Like down.
land into it and push
Yeah.
up and off. Does that make sense? So from like a Nordic position, fall into a Nordic, catch it, and then push off.
Yeah.
So that you get that stretch cycle immediately followed by a shortening cycle.
So that's just starting from a kneeling position, hitting the ground and coming back up, as opposed to starting from the ground.
If you start from the ground and you push up into the air and come down and catch, you've gone through a shortening phase, like that concentric contraction. Then you get your air time or your hang time, whatever you want to call it. And then you come down into the eccentric stretch phase. And that's not a true plyometric. So you just got to be careful with that. The second point on that would be for your repeated or continuous stretch shortening cycles, contact time is really important. If with something like a continuous clap push-up, for example, you let, depending on how you program it, if fatigue sets in, you'll end up with a really, really long contact time, and it ends up just being more of a power-based exercise rather than a true plyometric. So something like a wall option is a good place to start until they've got really good shoulder power, because they'll end up, if you're on the wall, you can kind of bounce off it pretty quick. If you end up on the floor too early, they'll just lag there and the contact time will be way too high. And it's just, you're still developing power, but it's not a true plyometric.
It's completely dependent on what your prescription is as well, though, Stack.
That's what I meant.
Depends on how you target. It's the same with tantrums. If you do 20 seconds of tantrums, you're going to gas out in the first 6 or 7 seconds if you go really hard.
Yeah, I think you've just got to be smart around what their actual underlying strength and power is. If you introduce the repeated, clap push-ups super early into the piece, it might look good, but their contact time's way too high and it's just not going to be effective. So you just got to be smart when you're programming.
Clap push-ups are bloody hard as well. I could do 4 and then I'm done. So maybe doing them from your knees, but doing it in a way where you can actually get through a good set of them before you fatigue and lose your form is really important. Because that, if we go back to one of the first slides, that amortization phase in the middle, that's like what Stacky said. You want to reduce the time where your muscles are working isometrically in the middle. You want to keep it as quick as possible. That's the goal with this stuff. So that probably comes into your programming, is allowing your, not to make it too hard that you can't do it well and do it fast and do it powerfully. Sick chat. Thanks, Stack. Now, I sat down and thought about how to program these things, and it's not clear cut with strength work where you do your 5 sets of 5 or your 3 sets of 12. It's not as kind of clear cut as that. They talk about how to, prescribe in terms of contacts. So you do a certain amount of contacts per week. So I've just put up a little table here where you want to do contacts, and over on the left side, 80 to 100 a week, getting up to over 120 a week for the more advanced ones. But then again, talking about advanced, you just make it more hard, more complex, and more intense. That's the way to increase it for an advanced person. But 2-3 times a week, at least 48 hours apart. And so this chart is something I found, which is just a little, I guess it takes you through a 5-week program of plyos. So they've just done, this is just a lower limb plyo program. So different variations of hops, 3 sets of 10 line hops, 1 set of 10 ankle. So if you go through all of those, 60 FC, that means 60 foot contacts. So week 1, you're doing 60 foot contacts in a session, then it goes up to 80. And they've kind of increased the complexity and gone down to 70 here. So in the final week, they're only on 50 foot contacts, but there's squat jumps, multiple long jump, lateral long jump, pike jump. These are all quite intense, and some of them are a bit more complex as well. So but if we think about how do we prescribe plyos, I'm always thinking, is it really intense? If it is, we're not going to do many. If it's not that intense, you can do heaps. Like pike jumps, 5 pike jumps is freaking hard, but 5 double leg pogo jumps is really, really easy. So in terms of prescribing them, that'll change it quite a little bit as well.
What's a pike jump?
You know what a pike is?
Like a pikelet?
You jump up and you tuck and then you land.
Oh, right.
Can you show us?
No. Good.
Oh, what the?
Like a gymnast jump.
Yeah, if you're a gymnastics thing, you jump up, you tuck your legs, you kind of give yourself a fetal hug, and then you land.
Yeah.
Show us.
No. Jump up, tuck, and land. Easy. So we got that there. That's kind of how you go about prescribing them. And again, to be able to do all of this stuff, you've got to be in the sort of the second half of your rehab. You're not going to do this when someone's in pain as well. So you've got to get them moving well, have good range of motion, have good coordination, have good timing before you're starting to add all this stuff in. So you don't add this too early when someone's in pain and not performing it well. You've got to be able to tolerate this. What else do we have? Okay, so this is getting to the end of it. So just a couple of little notes that I wrote at the end. when your patient can tolerate load locally with minimal pain, full range, and their capacity is increasing, that's when you're adding in plyometrics. And so when the patient's in front of you, just think about those 5 elements: eccentric, concentric, SSC, repeated, and then shock. And then, yeah, get creative. It's actually something where, as physios, we can just have a bit of fun. We can just like we all came up with different options for the shoulder and the Achilles. You can kind of make it up as long as you're challenging the demand of that tissue to get it back to sport. This is this part of rehab that can actually be the more fun bit, and you can get creative with it, and the patient gets more interested in it as well. So experiment with it and just get creative and have some fun. I think that's pretty cool as well. Yeah, sick. Any questions?
Patty, I've got a question.
Hit me.
Where would you program this in a week where a runner is going for maybe 3 or 4 runs a week, and they're doing some strength training, like heavy strength training, maybe once or twice a week? What does that weekly schedule look like with their plyos alongside like the strength training, their long run, their shorter runs, and all that, allowing time for recovery and all that?
It's a really good question, and I don't think there's an easy answer here, but a lot of the time running is viewed as a plyometric activity itself. So I know when my running volume is high, if someone got me in my running week to do hops and box jumps and squat jumps, I would struggle with that because I'm already doing a lot of that impactful kind of load. So to some extent, running itself is a plyometric activity. So when I'm looking at an uninjured runner, I do very, very minimal of that stuff. Only when their running load is like reasonably low do I do plyos with a runner. If a runner is like peak training and doing heaps of kilometers, they do their strength and they do their running, but I don't prescribe a lot of plyos for an uninjured runner unless there's some obvious deficiency. I've got a runner who's just come back from like a midfoot fracture and she can't really hop on one leg. So she's running at the moment, but we're doing hopping pogo style drills, but her running volume isn't that high yet. She is running, but it's not that high. So I'm getting her to do some plyometrics for her foot 3 times a week. And she's also running 4 times a week, but her running's only like 5Ks at a time. So it's not that much. So I'm doing that because there's a specific deficiency like in the tissue there. She can't do it. But for an otherwise healthy runner, I don't prescribe a lot of plyos if their volume is high.
Okay, and then let's say it's not a lower limb, let's say it's a shoulder or something like that, or maybe tricep or something. So maybe with a thrower or with like a boxer or something like that, are you saying that if they're not injured and they're just looking for performance, you wouldn't be really doing a lot of plyometric if they're already doing so much volume of their sport? So if they're already doing like a lot of pitching or something like that, or if they're already doing a lot of rounds on the bag, if they're a boxer, would you not be adding in plyometrics for performance because they're already kind of doing that sort of stuff? Or would you, and are you only then prescribing it really when they're trying to get back to something?
Yeah, it's tricky. And I welcome anyone's input here as well, by the way. But there is evidence so that specific plyometric training does make you run faster, jump higher, change direction better, hit further, generate more force. Like there's data to show that. So we do want to have it in there at some point in your training week as well. And I guess it's more, for me, the only issue there is too much volume. Like if you're at that tipping point of you can tolerate your maximum amount of volume and then adding plyos on top, if that's going to tip you over the edge, then we don't want that. So to add plyos in, which I think there is value, you just have to make sure you're not tipping someone over the total volume they can tolerate. And that's just like a subtlety in programming. I guess I don't have any guideline for that. Do you, Belly?
Sebi, I know this is your wheelhouse, bro. I know you've got something to say for sure here.
Yeah, the art of coaching and programming, hey? So thanks, Patty, as well. Awesome that you started with like the definitions. And if you think about like your true plyometric high stretch shortening cycle and low ground contact time as like if that's like your standard. And then following that, Patty's taken us through like an entire continuum of where if you break it down into your 5 phases, like eccentric absorption and then concentric expression if you pair that against the definition of a true plyometric, like you're not actually doing a true plyometric, you're training an aspect of what is a true plyometric on the continuum, which leads you up to like jump integration and then later to the shock method. So for people with like upper limb rehab and programming in or coaching in elements of plyos, like you can do eccentric absorption and concentric expression plyos within their training block. And then like day to day, you might have a plyometric block before they do their strength block as well. So you're targeting specific aspects of a plyometric without actually doing a full plyometric.
So do you mean like you get them, like if we think of the person's training session, they do a warm up or whatever, then they might do that component of the plyometric. So you might give them an exercise like the push-up leanings and they do 5 sets of 10. And then after that, they do their strength session where they do like their pec work, their rotator cuff work, their more brute strength stuff, and then they finish off. Like, is that kind of what you mean, Seb?
I suppose that's what I've learned with following that structure, mainly doing more plyometric type exercises prior to strength, because if your true plyo exercises are going to be limited by fatigue, and that's at the expense of good training, then it makes more sense to do them before you go and do your heavy strength work.
Yeah. So the stuff that I've heard about with plyos is that the quality of every repetition is super important. So it's low reps, low sets, decent rest in between sets. And as soon as the quality starts to drop off, that whatever component of the plyo you're working on is the reward that you're getting from that rep isn't really there anymore. So even though the climb will most likely not feel tired from the exercise, they're just not getting that. If it's a stress shortening cycle or that power, as soon as it starts to drop off, you're just like, cool, your plyo is done for today, whatever component that is. Go get yourself super strong. You've done your tendon work, go work on the muscle belly stuff now, and then go off and do whatever your sport is. So you just integrate it with your normal strength sessions, right?
Yeah, no, nail on the head. Like diminishing returns will happen so fast. If you're doing like double leg pogos and you can start off by doing sets of 20, which aren't that demanding, but you get to a third or fourth set in and someone's got like coming back from Achilles tendinopathy and then more to their mid-late stage, like their tendon stiffness is going to give away because their calf fatigue is giving away as well.
Yeah, because I've had this problem with a client trying to balance his strength training and his plyos. And we've worked on a base level of strength for a while since a hammy tear and a calf tear. And his hammy strength's good, his calf strength's good now. So I've told him, go, cool, let's pull back your strength work for 10, 20%. Let's pull back your load. And the beginning of every strength session is just you do your plyos, you do your 2 or 3 exercises, focus on the quality of them. And he's lucky he's an EP, so he kind of switched on with it. And as soon as like it's not snappy and not feeling really good, go and jump on the barbell and do some deadlifts and do some squats, and then do your soccer training twice a week around that.
I think so. I love that. And I remember having a chat with Belly a while back about how we can integrate Axit into stuff like plyos and seeing like change. Like a couple sets of plyos in the clinic doesn't take ages to do. But if you do like a drop jump at the start of your assessment and you get your RSI, so you can have a tangible number, you do 3 to 4 sets of plyos and you retest your drop jump. And if they're super fatigued, they're going to have a much different RSI compared to what it was earlier. And then they figure out that like, yeah, fatigue is going to limit the best outcome here of what I'm actually expressing for a plyometric.
So can I just jump in there, because all that is really awesome, and thanks for sharing. I was more thinking about those last phases of like what Paddy was saying, like what we do really well at iMove. Like once we've gotten them back to like a great level, and we want to then, they're no longer in pain, they're doing really well, maybe they're even back to sport. We want to get them even better than where they were before. So I'm thinking someone who potentially is no longer injured, or we've got them over the injury, or they're coming in for the performance, like Paddy said. We're able to improve performance with plyometrics. Where do we schedule in their plyometric work? And it kind of sounded like what you were saying, Sebi, is you do it before the strength training session. And what Mitchie was saying about like, they shouldn't be fatigued by it. So it's just all about the quality of the plyometric itself. So are you guys saying that the best time for that particular patient, so we're trying to improve performance now, is the best scheduling before they do their strength work? And just as soon as they start to lose form and show signs of fatigue, let's stop the plyometric and move on. Is that what you guys are saying?
Yeah.
Yeah.
So like,
As
so
long
like,
as they don't go for a run before they do their strength work.
yeah. So like, I listened to a specific example about like some MMA and boxing like fighters. And they were saying like they'll have a speed day where they just come in and just work on getting fast. And then it's the art of periodization with the coach. Like if the person's in their off season, you might just be like, cool, you've got 2 or 3 months. Let's do a little bit of speed work to keep it, but a bulk of your training is going to be strength based. And then as soon as you start to come in through your seasons or you're working up towards a fight, your volume of your strength will drop, and then your volume of your plyos will go up, like in that session. So they might not do as many heavy stuff, but really focus on going quickly. And then they obviously have to fit in their skill work around that. So like if it's an MMA fighter and a session is going to be more technical, then you go, cool, you could do your fast day on Monday and then your technical day on Tuesday, give you time like to adapt and get used to it. And then you could do another faster power-based session on the Wednesday. And that gives you that like 48 hours to do it. But that's where you got to like work really closely with the coach and figure out like what they're doing, like what they got coming up. Are they in off season? Are they peaking? Have they got a race? Like that sort of stuff. And then you just play around with the volume of plyos and strength depending on where they are. I'm not going to do a shitload of plyos during the preseason in soccer. I'm probably just going to do some like, if it's a soccer hamstring injury, I'm just going to do a bunch of hamstring strength and basic cardio fitness, and then do some more plyos in the early to mid season and do less strength work, because them getting a lot stronger in a deadlift 3/4 of the way through a soccer season, the reward's not really there. Like them putting 10 kilos on their hamstring curl at the end of the season, in that it's not really beneficial, but making the hamstring like really snappy and maintain the strength that they earned in the early season, in the preseason, much more beneficial. That's what I think. That's what I think I've come across. Someone else might have a different opinion.
Dick, thanks guys. Any other questions or anything?
I have another question if no one has. It's probably more of a question for Stacky regarding that amortization phase. So like, as Patty said, we want to reduce that time, right? But there's obviously like a, there's a difference between like, if you're checking for like jump height, I feel like I can jump much higher if I go deeper into it. And so I need more time in that phase. I guess when we're talking about that amortization phase, it's literally just the transition, right? Because sometimes if you get someone to try and do like a faster box jump where they are spending less time on the ground, they don't jump as high. Whereas if you let them stay on the ground a little bit longer in that eccentric loading phase, they're able to use more of that force to jump up. So I guess, is there any sort of like, do you cue around that in terms of like allowing them to drop into that eccentric phase and spend more time in that eccentric phase? Am I making sense? Like, do you know what I mean?
The short answer is they need more practice.
Okay.
Like develop more power and practice it more and just get better at it. That's the short answer.
Joshy, the amortization phase doesn't start until the stretch has stopped,
Exactly.
right? So like it might seem like they're spending more time on the ground, but they're not actually. It's just that transition. So just be trying to pick out when the amortization phase actually starts. So they might not actually be spending that much time in that no stretch phase.
Yeah. Thanks, DK.
I was trying to be concise.
Patty, I feel like maybe the question you were asking Josh, but even if it wasn't, we're talking a lot about the philosophy and the schedule and the periodization and the detail and how much stretch and how much shortening. But what are we doing with like a boobs on the run runner? Like, that's the question I want to know. So female, 40-year-old running the bay run, and she's doing her calf raises and a lunge twice a week with Mel. how are you prescribing your plyos for that person? That's what I thought Josh was asking, but even if he wasn't, that's really where my brain goes. Like, these other details to me are just like, how am I helping that lady? How would you help that lady with what you've learned from plyos?
So for me, we got to think like they're not going to be committed to an awesome S&C program in the gym 3 times a week. So it's a different person we're working with. So you want to reduce the intensity and reduce the complexity. So if you average boobs on the run runner, they'll get a lot out of some just double leg pogo jumps. And like 3 sets of 20 double leg pogos, emphasizing minimal ground contact time, could be super valuable for a boobs on the run runner, because by and large, they're not great in terms of like spring through their lower limb. They just don't really have that. So it's just little basic, super non-complex would be a great starting point. So get them to do some calf raises and some squats, but double leg pogos would be super valuable for them. I think that's where my mind goes.
And would you change anything else about their trainings, like part 2 of Josh's question? So if they were running 3 times a week, would you say, I want you to do less of that exercise, run 1 less time, and then add this in?
No, you don't want to change your boobs on the run program. If they're doing their 3 a week, you keep them doing 3 runs a week. Yeah. But if
on off days.
yeah,
Yeah. So you get used to it.
Yeah. So like, Matt, I don't know if you heard Maddie just said, do pogos on the days you don't run. So, and different people have different appetites. So some people will be like, yeah, I want to do something every day. So 3 runs and then 4 days where you do pogos. That's cool. Some people are like, I want to minimize, like I just don't want to do that much. So cool, do pogos twice a week as well. That's just your individual programming stuff. That's kind of where my mind goes. Anyone else? But yeah.
Could you just get them to do the pogos before they run? Because I get a lot of runners saying, "Oh, what's a good warm up to do?" And they always want to know stretches.
Yeah.
But I find like if you just give them 2 or 3 decent plyo drills and say, "Just do this," you get your heart rate up a little bit, because the I guess the plyometric load in running is a little bit less than the hopping or whatever drill that you're giving them. And then if they're doing it 3 times a week, they're still getting 4 days of rest to give that tendon enough time to recover.
I like that. Even in the clinic here, like that's what Denny Smith does. If he says, all right, we're going to jump on the treadmill, he actually gets them to do some pogos while he's like getting the treadmill set up for 20 seconds. He does that in clinic. So like, yeah, I think it's a great warm-up drill. And if it's like time cost minimization for a boobs on the run runner, then yeah, before a run, I think is sweet. If you're getting them to do calf raises anyway, why can't they do it for 30 seconds before calf raises as well?
It gets people to bounce all day though, like regularly during the day. Bounce. Like get used to being on your feet.
Yeah.
Like 3 times a day.
Yeah.
It was short stints though. Like 20 pogos.
Can you guys see what Maddie is saying? Yeah. So yeah, there's no easy answer, Mick, but yeah.
I always thought to do less plyos, like if it was an average runner who'd never done them before, I would tend to only prescribe them once or twice in a week and see that was enough to improve them. I always felt that 3 sessions of plyo plus what they're doing would be a fair bit. And a fair bit might be okay, but it might reduce their performance on their actual run if they were doing it 3 or 4 times a week. That was my feeling, but I don't know if there's any truth to that.
And I think we just look at the overall weekly load and volume, and 3 runs a week and 3 plyo sessions for some people is putting them into a state of overload. And your performance will decrease, your risk of injury goes up. So we've got to remember we're only doing this to make them better athlete or make them more resilient human, train their musculoskeletal system. So it's got to be productive. So if someone's quite new and inexperienced, 1 or 2 sessions a week plus 3 runs is probably quite a lot.
Yeah. And so Paddy, just to translate this into practice, keeping on that theme to like wrap up our CPDs, but so we actually implement the change and get like that 1% change every fortnight.
Yeah.
What would be a suggestion to like integrate this into our next 2 weeks? Would you put like a reminder, change something in the treatment notes, or just think about your everyday injury that maybe you weren't going to go into plyos for?
What you just said at the end there, for that person who's like, oh, I'm like 80% better, I'm feeling really good, minimal pain, I'm doing a lot. That's when you go, sweet, let's go like plyos now. So those patients who you're like, I could discharge them this session or next session, you've probably got a couple of sessions of plyos in you to take them, or just think about taking them beyond the state where they were when they got injured. So yeah, probably wouldn't add anything into my treatment notes on the back of this, but I would just like when you look at the next 4 hours of what patients you have, who can I like add in a plyo for, just to get them prepared for their sport.
Yeah, that's a nice cue. I even think with like plantar fasciitis, Achilles, and even back pain, like back pain patients often don't get used to shock or fast motions. And often that's how they hurt their back. Like something drops, the kid jumps on them, they drop the pen and react. Getting some kind of like med ball slams or rotation slams, some kind of plyo for your everyday patient, I think is a good thing to think about. Thank you, Paddy. That's awesome.
Cool, thanks.
Can you